everyone, my name is Nicole and I'll be your nurse today. So I'm here because I'm going to be changing your CVAD dressing. Can you give me your full name and date of birth?
So I'm going to go Sol 10/03/2000.
Okay, and I'm going to check your wristband real quick. Okay, everything looks good. So today I'm just going to be changing your old dressing, taking it off, and then assessing the site and then putting on a new dressing. Do you have any questions about that?
No.
Alright, and then have you had your CVAD dressing changed before?
Yeah.
Okay, sounds good. Have you been having any pain today? Okay, that sounds good. And also, do you have any allergies with chlorhexidine, latex, or anything else that I should know about?
No.
Alright, so I'm gonna get my surface set up and then we'll get started with your dressing soon.
Okay.
I'm gonna do hand hygiene for 20 seconds. Then I'm gonna put on some gloves. Just gonna grab a wipe and then wipe down my surface. Completely saturate it. Okay, I'm gonna throw my wipe away and also throw my gloves away. Gonna let my surface dry for 2 minutes and wait until it's completely dry before I put my supplies on my table. Then I'm gonna do hand hygiene again. Once it's been 2 minutes or I see that my table is completely dry, I'm gonna set up my supplies. I have my tray over here. I also have my bio patch. Just gonna set up my tray. And then since my patient isn't wearing a mask right now, I'm just gonna give her the one in my dressing tray and she's gonna put that on. I'm also going to only touch the outside of my sterile gloves and then set that up. Right here, gonna grab my bio patch and I'm gonna drop it in and then throw this away. Then I'm gonna do hand hygiene one more time just in case before I take off the dressing. Next, I'm gonna put on some gloves for removing the old dressing. And then can you turn your head to the side so that we can prevent an infection? Make sure that you're comfortable. Alright, so when I take off your dressing, there should only be discomfort, a little bit tugging, but you shouldn't feel any pain. If you do, just let me know and then we can stop. Alright, so I'm going to start by stabilizing the catheter and then pulling at the edges. Alright, and are you still doing okay?
I'm okay.
Sounds good. And continue to stabilize my catheter. Removing the tegaderm right now, still stabilizing the catheter. And also I can remove the bio pouch and slide that right out. Alright, throw these away. I'm also going to dispose of my gloves. Just gonna look at the site real quick. Everything looks fine. There's no redness, no signs of infection, no swelling, no inflammation. There's no cracks, no leakage, also no drainage. Everything looks okay, and I'm gonna check the markings on the tubing, make sure that it hasn't been displaced. And it looks like it's still in the same place compared to how it was previously documented. So everything looks great, and we're just gonna move on to creating the sterile field and putting on the new dressing. Okay, I'm just gonna do hand hygiene again. Okay, and then can you turn your head to the side again when I'm changing your dressing? Thank you. Okay, I'm gonna only touch the outer edges of my sterile gloves. Try to stretch it all the way. Alright, and I'm gonna put it on my dominant hand first, making sure I only touch the inside. Okay, and I'll fix that later. I'm gonna put my fingers in the cuff, make sure I'm not touching the inside, only the outside of the glove. Okay, next I'm gonna fix the cuff of the glove. And I can fix the cuff of this one too, with my dominant hand. Alright, now I'm just going to pick this up, drop it in the trash can. Alright, and then now I'm just going to take this swab, break it, and then I can tap it down to make sure that the chlorhexidine is coming out. So now my non-dominant hand is going to be clean, not sterile, so I can hold the catheter. I'm going to create a 2-inch square window, scrub it back and forth. Okay, and are you feeling okay?
I feel okay.
Great. Next I'm going to clean the tubing. Drop this back, and then just drop my swab into the trash can. I'm gonna let it dry for 30 seconds, or I'm gonna make sure the skin is completely dry before I put the bioderm or biopatch back on. Okay, now that I see it's completely dry, I'm gonna take my biopatch and then take the catheter again, fold it in half. I'm gonna slide it onto the tubing, make sure that it's centered, and place the catheter back on. Next, I'm going to take the tegaderm. Then I'm going to use my non-dominant hand to peel the backing of the tegaderm. I'll drop that into the trash can. I'm going to grab the catheter with my non-dominant hand again, create a loop for the catheter, and just try to place it in the middle. I'm going to press it down slowly to make sure that there are no bubbles. Okay, now I'm going to peel the edges of the tegaderm. Okay, are you still feeling okay?
I feel okay.
Okay, we're almost done. I'm going to be pressing down the tegaderm as I go. I'm gonna take the tape off the paper. I'm gonna put my initial and the date and the time. And then just gonna stick that on. Then I'm gonna grab a piece of tape to secure the catheter. Gonna secure that in place. Okay, and everything looks good. So I'm gonna clean up my workspace. Throw everything in the appropriate bin. Okay, and I'll just take off my gloves. Alright, you can turn your head back if you would like to. Are you comfortable?
Mm-hmm.
Okay, and how is that dressing change for you?
It was good.
That was good? Okay. I'm gonna make sure your collarbell is within reach, but at the lowest height. I'm also gonna do hand hygiene right now. Okay, looks like I'm gonna put 2 to 3 side rails up. So I'm gonna go chart and document the dressing change. It looks like everything went okay for you, no pain. I'm gonna make sure that I write down that there's no cracks or leakage, no drainage, and there were no signs of infection, like no redness, no swelling, no inflammation. I'm also gonna remember to write down my initials and the date and the time I changed your dressing. Do you have any other questions for me?
No.
All right, it looks good. What did I